I've been talking a lot about MVX. It's the best test to measure longevity and health, and it gives you a direction to go down if you want to improve your health related to chronic illness and maintaining your health. And I have 15 different ways that it should be tested. I've talked to several researchers at LabCorp, and it's not their forte to run these kind of clinical tests. So I'm looking for a researcher to help me out, maybe somebody who's new out of school and they're looking for a new project and maybe a little bit of fame. So let's talk about these 15 tests. The point of MVX is the metabolic vulnerability index is that it has 6 factors, and these 6 factors are lined up in such a way that you can make them go up or down and improve your overall score. And if you don't know too much about MVX, make sure you see my other videos about this. But experiments at Duke University have shown that 2 therapies have been proven to not lower MVX. You want a lower score. One of them is exercise. So there's several doctors on social media saying that exercise is the most important thing to make you live long and be healthy. That's completely not true. MVX proves that. And it makes sense too, because there are people who exercise a lot and they end up dying of a heart attack. So in order to live a long time, you have to have correct biochemistry in your body, and just moving your muscles and breathing deeper does not improve the biochemistry within your body. And I'll give you an example. My grandmother died at 98. She did not exercise, and she lived to be 98. So another therapy that has been proven to not lower MVX is cholesterol-lowering drugs. And they did before and after MVX tests with people who started cholesterol-lowering drugs, and they did not get better. And this is true for every single drug. You can test any drug, and there are no drugs that improve the health of mitochondria, which is the point of improving your lifespan and your health, and also lowering your MVX score so that you can live longer and be healthier. So these 2 studies have been done, and I don't know of any other studies being done. And this isn't really like within the medical field to try to improve health. And that's what MVX is all about. So I was talking to a researcher who knew about these 2 tests. And I told her, yeah, it makes sense that exercise doesn't lower MVX. And it makes sense that statin drugs do not lower MVX. Like, I can predict what will lower MVX because in my 30-year career, I figured out what I call the 7-step blueprint to optimal health. And it does not include exercise, and it does not include any drug except for maybe antibacterial, antiviral, anti-parasitic drug, or even anti-mold. So here's my 7-step blueprint to optimal health. I made this graphic somewhere around 2018, 2019. So I solved MVX 5 years before it was ever released. It was released January 6th of 2025. The first step is diet. So I have several experiments that should be run to see if any diet changes MVX. And we're talking about keto diet and vegan diet and comparing these 2. And you can test any diet. Just do an MVX score and then change into your diet for 2 months or longer, and then redo the MVX score and see if it goes down. Step 2 is energy. That's enhancing mitochondrial function. And B1 is the best supplement for that, in my opinion. There's going to be other supplements, of course, but I have an experiment regarding B1. And I want you to listen to this whole video and just pay attention to what I say. And maybe one of these experiments will trigger a bell in your head, and you might be interested in helping me out. And I really need hundreds or maybe thousands of people to run your own experiment on yourself and give me the data. And we'll put all this together. So I've run this on myself now 3 times. And the first score was 55. The second score was 31. And then I just got my 3rd score today, and it went up a little bit to 39, I think it was. But at that time, I actually had a sinus infection. I'm just going to keep testing it every month and just bring it down. So the step 3 is drainage. And I don't really have any experiments on that. Drainage is cleaning out your liver, kidneys, gallbladder, colon, making sure everything's working well as far as your body's natural ability to clean itself out. Lymphatic system, lungs, sinuses, skin, all these organs clean the body out. But steps 4 and 5 have to do with cleaning out parasites and other organisms out of the body. Step 4 is more about the gut. Step 5 is full body detoxing, cleansing of organisms. And then step 6 is detoxification of metals and chemicals and radiation too. I have experiments with that I'll go over. Step 7 is Lyme, getting organisms out of the cells, out of the mitochondria. And there are other organisms that live inside the cells, such as Babesia, which is a parasite, viruses, bacteria. They can all live in cells. And there's labs that we can run beyond MVX to verify that you have something. But the point of this too is, like, if you have Lyme disease and you want to run an MVX experiment, such as get your MVX test run, go on a Lyme protocol, like herbal, if you will, and then 4 months or 6 months later, do another MVX test and see if the MVX score drops. Like that would be a great thing to do. But these steps are in order. If you're filled with metals and chemicals, like in step 6, then it's hard to do step 7. If you're filled with parasites, like steps 4 and 5, it's hard to do step 6. If you're trying to get parasites out of your nose and sinuses or out of your fingers, if you have arthritis, you can't really do that unless you do step 4, which is more focused on the intestines. See, and then before you do step 4, intestinal cleansing, you got to make sure you're pooping good, which is step 3, drainage, and your lymphatic system, liver, gallbladder, they have to be working well. But you have to have energy to do all that, and you have to have a good diet. So you have to do these in order. So this is what I've been doing for many years with patients. I walk them through this program. It takes 6 months to a year and a half, maybe longer, 2 years, 3 years, and then they get better. Step O is optimization. That's adding minerals and other nutrients, but that can be done at any point along these 7 steps. So now that I've given you this background, let's talk about these 15 studies in order, step 1, 2, 3, like that. So we're going to do these in the order that we have here. My first experiment has to do with the ketogenic diet. So the procedure is test your blood with Keto Mojo at home and be out of ketosis for 2 months straight. Then test your MVX. So then get into ketosis. That means your GKI is below 9.0. And the Keto Mojo blood test that you do at home gives you that score. And if you're below 9.0, then you're in ketosis. Do that daily for 2 months. Make sure you're in ketosis for 2 months. And then change nothing else. Don't exercise more. Don't do any detoxing programs. And then retest your MVX. Keep all the other variables to a minimum. Just basically focus on being in ketosis. The next dietary test is regarding seed oils. Now, in the medical literature, there's no studies, no science that shows that seed oils cause any harm. Even though RFK Jr. thinks that they do cause harm, I do think that seed oils cause harm, but I don't have any science to back that up. And when they test the science, they're using inflammatory markers such as homocysteine, but MVX is better than testing with homocysteine. MVX has a factor called glyc-A, which includes homocysteine and like 9 other things. So when glyc-A goes up, it's a disaster. It's like high inflammation, lots of infections. And the other aspect of seed oils is that I think it might be damaging to some of the lipoproteins, and MVX tests a lipoprotein called small HDL particles. And so we want to see with this experiment, consume 3 tablespoons of cottonseed oil per day for 2 months. And we'll see if glyc-A goes up, if the small HDL particles go down, which would be a bad thing. Change nothing else. Don't change your diet in any way other than consuming 3 tablespoons of cottonseed oil per day for 2 months every day. And then retest MVX. The reason why I picked cottonseed oil is because it's the most popular of seed oils in restaurants. And I think if this shows up as a problem and it lowers MVX, that would be the first science to show that seed oils are bad for our health. My third test, also a dietary food experiment. Eliminate all processed foods and eat only meat, vegetables, and fruit. No grains, no bread, no sugar, no pasta. Just real food, no grains. I don't consider grains food, in my opinion. My whole career, since 1999, I've only purchased 5 loaves of bread. Like, that's how little I think of bread. And people argue with me like, oh, my bread is Ezekiel, it's organic, it's sprouted. I'm not impressed by any of that. So this is for people who eat a standard American diet, which is 50% or more processed food. So the procedure is test MVX, get your score, then change your diet by eliminating all foods except meat, fruit, and vegetables. No desserts, candies, cookies, cakes, no pop, no grains, no rice, no bread, no pasta. And change nothing else. Don't start exercising more. Don't sit in the sauna for a longer period of time. Do this for 2 months straight, retest your MVX. And if we had 100 people doing this, we can get some really good data. This is more of a snapshot test. What we're doing is comparing 200 vegans versus 200 keto carnivore dieters and see who has the lowest MVX scores. So if you've been a vegan, I'll include vegetarians. If you've been a vegan vegetarian for a couple of years, just get the MVX test run and send it to me and give me a little note. Hey, I've been a vegan for 2 years. I've been a vegetarian for 4 years. Let me know. And if you're on the low carb keto carnivore diet, get the MVX test run and just send it to me and give me a note like you've been keto or cycling keto for 3 years, or I've been carnivore since 2018. That's true for me. And so just give me a note on your diet. So this is to discover if there's a difference between MVX scores and vegans versus ketovores. And so that's how you do. That'd be great if you could help me out with this. And I've never been published in the research before, and that's why I'm asking for a researcher to help me out with this. This is test number 5. Again, it's related to food, and it's specifically about the high amino acids. So when you look at the MVX scores, 3 of the 6 are branched chain amino acids. And if they're very high, I think B1 will bring it down. I got science to show that. So the best B1 supplement is called Thiomega, and you can purchase that. I got a link right here. And if you do have high amino acids on the MVX test, I would like you to verify that through this lab called ETKA test. You can get it at hdri-usa.com to see if your B1 is truly low. So if you have a low B1 status in your body, these branched chain amino acids will go high. When they go high, you become insulin resistant, you get a fatty liver, your blood glucose goes up, your blood pressure goes up. This is metabolic syndrome. This is what everybody's suffering from. You get a fatty gut, you get the higher hip to waist ratio, you start gaining weight, and a lot of it has to do with a B1 deficiency caused by a high carbohydrate diet. So the procedure would be test MVX and see if these 3 amino acids are high, and then test the B1 status with the lab I just mentioned. Take Thiomega. I would say take 3 per day, change nothing else, do it for 2 months, and then retest MVX and ETK after 2 months. This experiment right here would be revolutionary when it comes to chronic disease. This is like RFK Jr. worthy. Like, he needs to know about this. This test is also related to the branched chain amino acids, the valine, leucine, and isoleucine. And sometimes they show up low, and that's called cachexia. Cachexia can be a scary, like, end game. Like when your health is really bad for a long period of time. If you have cancer or you had a heart attack, you end up getting cachexia. You can't gain weight. You eat a lot of food, but you're not digesting the food. So the branched chain amino acids kind of go away and you lose muscle. You're wasting away. That's what it is. I think the best solution I have for this is actually raw animal foods. And I have a story to share with you about this. So we have a patient in my office. I did a whole video I interviewed her for like an hour. It's on my YouTube channel. She had endometrial cancer with cachexia and metastasis and ascites. So the cancer was spreading and she was retaining fluid in the gut. And with our recommendation, she started eating raw eggs. And, we gave her the choice: raw meat, raw liver, raw milk, raw cheese, whatever. It's got to be some raw animal food. So she started eating 12 to 18 raw eggs per day. And after 2 years, all of her cancer was gone. The cachexia was gone. She saved her life. She got rescanned. Everything was gone. And that was, that's been now over 3 years. So to increase the branched chain amino acids when they're too low, pick a raw animal food. So I wrote raw milk, eggs, butter, meat, liver. Sorry for the typos. Change nothing else. And this would be a hard one to do because cachexia is scary. But you can have low BCAAs on this test, the valine, leucine, and isoleucine, and still feel fine. But the point is, you got to bring that up. The point of eating these raw animal foods, it's really good for the digestive system. And it could potentially fix up your liver, gallbladder, small intestine, stomach, pancreas. So retest MVX after 2 months and see what happens. So I have a note down here at the bottom, and this is another idea to raise the low branched chain amino acids, is to find which digestive organ needs the most help and then repair it. And that's what we do in our office. We're repairing organs all the time. We have multiple supplements to repair the digestive organs, and we can pinpoint the gallbladder. We can do broad general digestive support. We can pinpoint the stomach, the small intestine. Okay, so all these tests that I've been talking about have to do with step 1, which is all related to the diet. Now we're talking about step 2, which is energy enhancement of the mitochondria. So here's my experiment. Add 15 minutes of red light and test MVX before and after 2 months. So the procedure is, first of all, get some kind of red light therapy, and maybe you have a red light sauna. I have a red light panel. I also have a red light mat that you can lay on. So you can buy these for $300 up to $600 or more. I got mine at a pretty good price at $300 years ago, so maybe it's more than that with inflation. But do 15 minutes per day. It's been shown that red light at 15 minutes per day can lower your glucose by 27% after a 2-hour postprandial test. So red light can be great for your mitochondria. So to lower your glucose by 27%. That's amazing. So do 15 minutes of red light daily for 2 months and then retest MVX. Okay, now we're talking about steps 4 and 5. This has to do with parasites and other organisms. And in MVX, there's this factor called glyc-A. I kind of mentioned it. And when glyc-A is high, this is horrible. And you have to fix your immune system. The normal range for glyc-A is actually 260 to 300. And a lot of people have their score over 300, including mine. I did get mine down 35 points, but then when I got my test redone for the third time, I had an infection. It went up, even more. But yeah, the goal is get it below 300. So if your glyc-A is over 300 and you want to experiment, there are 2 tests. One is called the hypercoagulability panel. And what this does is it measures how much fibrin you have in your body. Fibrin is the basis of blood clots, plaquing in the arteries, biofilm, and scar tissue. Now, the biofilm is what I'm looking at because organisms such as mold, bacteria, virus, parasites, candida, they all make biofilm and they live in it. So if you have a lot of fibrin in your body, these organisms make a really strong house. And there are genetic factors and there are nutritional factors that will maintain a high amount of fibrin in your body. I ran this panel on myself and I have a genetic factor. Now I have to take 2 lumbrokinase per day on an empty stomach for the rest of my life because I have what's called a 4G deletion. And so therefore I'm at high risk of clotting just because of my genetics. And there's going to be a ton of people, if you've ever had a stroke or if you have a family history of somebody in your family that had a heart attack with plaquing, you got to get this test done for your genetics. So the other test, if you have a high glyc-A, is called Cyrexarate-12. And so I broke that up. Here we have step A and then step 8A. So this is where we talk about Cyrexarate-12. So I'm recommending both if your glyc-A is high. So let's talk about this first one, the hypercoag panel. Get your test run, and if glyc-A is high, then test the hypercoag panel. Based on what that says, address it correctly, and we can help you with that. The primary therapies are lumbrokinase. The other one is the actual blood-thinning drugs. Those are the 2 therapies, and there are medical doctors that can recommend the drugs. 2 months later, retest MVX and see if the glyc-A drops because you have lower fibrin in your blood back to a normal level. Change nothing else. But this does not address infection. See below. So below, we have when glyc-A is high, identify any and all infections and treat correctly and terminatedly. So just because you took an antibiotic doesn't mean you corrected the problem terminatedly. You might need to do some drainage. You might need some Spanish black radish from standard process. You might need some binders. So these are things that we help people out with. Use the test to look for infections, Cyrexarate-12. That's the name of this test. It's a great test. I'm going to show it to you in a moment here. 4 months later, retest MVX and Cyrexarate-12 to see if the glyc-A drops and to see if your full MVX score drops. Here's the Cyrexarate-12, and on the left we have a person who got it done, and she had a lot of infections. If you look over to this pink side over here, we got 1, 2, 3, 4, 5, 6, 7, 8, 10 things that are high. Yellow is moderate, green is good. And so if you look all the way over here, we got bacteria, we have viruses, parasites, there's more bacteria, there's Lyme right there, there's mold right there, and more viruses. And at the very bottom, Borrelia, which is Lyme. 9 months later, this person was like in really good shape. Look over here, they're all green. Look all the way down, except for this one all the way over here. And she was feeling a lot better. And what did it take to eliminate all this? Well, you have to do it holistically. You can't just take an anti-mold drug, anti-parasitic drug, antibacterial drug, antiviral drug. Like, it doesn't work that way. You have to do this holistically. Another aspect is if you have a chronic sinus infection, it can drip down in your body, causing more infections in your body. So it's not always about just taking pills. You have to address things up here topically. All right, let's get back to these experiments. Here's number 9. This is for parasites. This is step 4 and 5 in the 7-step blueprint to optimal health. So do a parasite cleanse and see if MVX goes down or glyc-A goes down. So my favorite supplements for this are Para 1, 2, and 3, and 4 from Cellcore Biosciences. So test your MVX if you have high glyc-A. That indicates infection and or inflammation. We already talked about the hypercoagulability panel. But also then do this, gut zoomer right here, or test Cyrexarate-12, which I already talked about. go on a parasite protocol for 5 months using para 1, 2, 3, and 4, and then change nothing else. Retest MVX and gut Zoomer or Cyrex array 12. So we're looking to see if a parasite program eliminates parasites and gets the test lower. So, been doing this since 2007. People poop out parasites that are like super long. Most people actually see parasites coming out. So as I'm going over this, I'm actually realizing a lot of these experiments require you to be a patient in the office. The dietary ones I talked about at the beginning, not so much. But to help with getting rid of parasites and doing like a heavy metals detox, for example, having mentioned heavy metals, let's talk about this one. This is more of a general, like, let's see what happens kind of viewpoint. So if you do MVX and your citrate is high, then run this test called total tox burden. So just see if high citrate equals a high toxic burden as determined by total tox burden lab test, which is a urine test. So related to that, if you do have a high citrate level and you do have a high amount of toxins as seen by the total tox burden urine test, then do a heavy metals chemical detox program. Here's the link to total tox burden right here, and do 5 months of binders from Cellcore. And I'm also working with another company called Bio1 Sciences. Change nothing else. Don't do like extra exercise. Don't go keto. Just do the detox program. Retest MVX and total tox burden after 5 months. Here's an example of how detoxing makes you healthier. This graphic right here comes from the Bio1 Sciences, the company. And you can see on the left, March of 2021, and all the way to the right, May of 2023, this person had a lot of reds on the left. Their symptoms were very high, 10s and 8s and 9s. And all the way to the right, their scores were green, 3, 1, 0s. There's a 5 there. So the point is, we have about 10 of these examples of people going on a detox program and all their symptoms go away just by detoxing. And what does it take to detox? You just take pills and time. It's not like you have to, like meditate 5 hours a day and not go to work. Like you just easily incorporate this in your lifestyle. Okay, you still with me? You're doing good. We got a few more. This is number 12, related to detox. So my recommendation is to do an intense sauna detox program. And there's one called the Purification Rundown, which I've done 3 times. The last time I did it was February of 2025. I was in the sauna for 18 days in a row. I took a high amount of niacin. I got up to 5,000 milligrams of niacin. And I was in the sauna for more than 4 hours a day. And so if you were to do that, and some people are in this detox program for 2 months because they just have a lot of toxins. You can actually feel the toxins as they come out. And I went in because I had a gas leak at my house for all of 2024. So my first day in the sauna, I could smell chemicals in my nose, probably coming from my lungs and my sinuses, for 5 or 6 hours after being in the sauna after the first day. I feel so much better after having completed this. The book that talks about the Purification Rundown is called Clear Body, Clear Mind. Now you can do your own sauna detox at home if you have a wood box or a canvas sauna at your house. But if you want to do the hardcore one, the one that's been done on hundreds of thousands of people, that would be the Purification Rundown. So my recommendation is if you're going to do it at home, then do it for a minimum of 30 minutes for at least 25 days. The goal is profuse sweating. Drink lots of water, take minerals and salt, change nothing else, retest MVX after 25 days or after doing the Purification Rundown. So mine was only 18 days, but like I said, other people could be 50 days. So here's another interesting experiment. This is for people with a high coronary artery calcium score. If you have heart disease, you take these 3 products. These are all supplements. You can order them without a prescription: NanoBactX, Med5, and Cavidex. So these are supplements that are designed by cardiologists to eliminate plaquing and infections out of the arteries. Take these 3 supplements for 2 months straight. Change nothing else. So NanoBactX is 1 pill per 20 pounds of body weight before bed on an empty stomach. Cavidex suppository once per day. There's the website. Then Med5, 1 tablet in the morning, 1 tablet at 3 p.m. There's the website. Change nothing else. Do this for 2 months straight. Retest MVX and retest the coronary artery calcium score if you can. We got 2 more. This is about Lyme. This is step number 7 out of the 7-step blueprint to optimal health. Do a Lyme protocol and see if MVX and or glyc goes down. And you can use this Tick-Borne 1.0 lab test to verify Lyme. So here's what you do. You test MVX. If you have high glyc and you suspect Lyme, then do Tick-Borne 1.0. There's a link to go get that. Or you can use Cyrex Array 12 because it has some Lyme organisms in there. But the most robust test and probably the best in the world is from Vibrant America right here, this first link right there. Okay, so you can do one or the other. Go on a Lyme protocol for 5 months using the IS products from Cellcore. They have 4 products: IS Bor, BART, BAB, and Boost. IS stands for immune support. These are all herbal. They're not prescription drugs. They work really, really well. I've had people eliminate their arthritis, increase their energy, and just get a lot better because we cleaned out their cells of these Lyme organisms and whatever other organisms and toxins are in the cells. That's how you clean the cells out, with herbs. Herbs are brilliant. They have a high IQ. Herbs are really good. Change nothing else. Don't start keto diet. Don't do a heavy metal detox protocol at the same time. Just do these Lyme herbs. Retest MVX and Tick-Borne 1.0 or a Cyrex Array 12 after 5 months. This is the last experiment, and this has to do with oxidative therapies. That means oxygen. Now, I don't do these, but I know a bunch of holistic MDs that do these, and I so appreciate them. They're holistic. And so if you have a holistic MD and you want to test these oxidative therapies, I'd be a fan of that. That's a great idea. Ozone, hyperbaric oxygen. There's another one called EBOO, which is right below me right here. Extracorporeal blood oxygenation and ozonation. That's where they take the blood out of your body and they clean it, and then they put it back in your body. So here's what you do. Test MVX, then start a treatment plan of ozone, which could be IV, or insufflation, which is where they put it up your rectum. It's kind of like a reverse fart. Works really well. Or start a treatment plan of hyperbaric oxygen therapy, or start a treatment plan of EBOO and change nothing else. Don't change your diet. It'd be good if your diet was, a healthy diet. But do this for 2 months straight or until the prescribed program is done, and then retest your MVX. So that's it for these experiments. When I discovered MVX and tried to figure out, like, what is it composed of, I realized, well, I know how to fix this. And then I got it activated January 6th of 2025. And it's like, okay, now what? I started talking to a bunch of researchers, PhDs, MDs about MVX. The people that designed this test, I talked to them. And but they're not into the clinical trials, which is fine. And they encouraged me to get my own funding, to get my own writer to write the articles, and get my own sponsor and get IRB approval. The research board has to approve it. And it's like, I don't know. I've never been trained on this. I was not set up to do this. So if you know somebody who is a researcher and is interested in doing this and help me out, that'd be fantastic. It'd be kind of like the relationship between Dave Feldman and Nick Norowitz. If you're in the keto carnivore community, the lean mass hyper responder community, you understand how Dave Feldman, as a software engineer, had some brilliant ideas, and he just started putting out his content on YouTube, and he attracted Nick Norowitz, a Harvard student, and together they've done some great research, and they got published, and it's revolutionizing lipidology and cardiology. And the cardiologists are like really pissed off about it because they don't like change. A lot of people don't like change. But MVX is such a powerful test. I believe this is the beginning of the end of drug-based medicine for chronic disease. And I'm not trying to get rid of all drugs. I'm trying to get people healthy. And in order to get people healthy, it comes down to nutrition and detoxing. As a matter of fact, detox is first. So the best way to reach me right now is by using this email called info@thenhcaa.com, and send me your ideas and give me some updates on what you're thinking and how you can help out. Thanks.